Okay, so finally, I've been looking forward to doing this for a while. Um, and that would be the discussion. So I went ahead and I looked at the discussion, and this has to do in regards with the nursing field. In the very beginning, if you guys remember, I can't even believe this is half of the semester is over. It's wow. Um, and the holidays are here. So I had asked you to let me know if there's anything you're interested in. I'm doing my very best to try to touch on subjects that I can. There's certain things I have to do in the curriculum. It's just, so hopefully you're getting a lot from that. And as I had mentioned the other day, I just want to mention it really quick in this video, and then I'm going to do the diabetes video, which is we actually have a lot of extra classes. So the way we broke it down, more my it's my I've never taught this class before, but we end up having like 30 something classes, which we don't need. Not that I don't want to teach you or not that you don't want to learn. And I hope it feels like you guys are getting something from it and you're very engaged, and a really good class. And small or not, I mean, I've been very impressed and happy to teach this class. So this portion is, if you're not interested in healthcare, this is not an assignment. This is more of me taking some time to kind of mentor, help. And if you have any further questions, I'm not, I'm going off the cuff. I did that on purpose. I briefly looked at the questions for like maybe 3 minutes, but I really wanted this to come straight from like my first reaction rather than me thinking about it. So I took pictures on my phone of the questions, and so that just in case the person who was asking the question didn't want everyone to know that they were asking. So the first question is, and again, this is related to the healthcare field, just getting some guidance or maybe advice or what my thoughts basically. So does it mean that I'm absolutely right? This is just my opinion. So the first question is going to be, do you recommend getting into an LVM program first and then RN? And then it says, if we're looking to become RNs. So the question is basically asking, if the end goal is to become an RN, would you recommend doing LVN to RN or going straight into an RN program? Which, if I'm sure most of you that are interested in this talk, and I believe just as an FYI, this video will probably be about 35 minutes long, just so you can time your time. I think I have like 7 questions. And then just so you to end the question, or straight into an RN program. So basically the question is, and I get this question a lot, and I find this question to be actually pretty special and special to me for a specific reason. And that is this. So an LVN is a licensed vocational nurse. Most of us are probably familiar with that. And this type of nurse is considered, and not in my personal opinion, but it's a lower level nurse. And when I say lower level, I don't mean less than or not as good, or I mean, my mom was an LVN for God, I can't even, almost 40 years, and she could run circles around some of the RNs. So when I say that, I don't mean that as a disrespectful thing. What I mean is that it's a different level of thinking. So vocational nursing program, because and we always call it the LVM program, which I think is funny because you're not licensed yet. So really it's called the vocational nursing program, which we have at Mission College. That's the one that I'm the assistant director for. And then Marsha Oliver is the director. And then we have our RN program, who is ran by Judith Berkeley. And I work in both of them. So, and many of the schools now are doing it, LVN and bridge programs, which means LVN first, then you go LVN to RN. I would say that this has a lot to do with a couple things. Number one, desperation. And I don't mean that as a negative thing. That's actually what happened to me. And I will tell you, I am actually really glad I did it this way. Yes, it may have taken a little bit longer, and I'll explain why. This is probably the longest question, by the way, because I think it had affected me so much that I have a lot of opinions on this specific question. And it's so confusing. And I feel so bad for so many of you out there that just, it's like you feel lost and you have nobody to ask. And it's like, what do I do? And it's just so confusing. And this one school has this prereq, but this one has this, and I want to apply for both. And it's so compacted and it's so difficult to get into a program, and you work so hard. So there's a lot of emotions kind of bottled up with everything. So I guess in my personal opinion, if I could make it to where it had to be this way, I would make it a requirement to do CNA, but I would make it to where it'd be a stream almost. Like you would have first kind of dibs almost, like between going in CNA first, because I think that gives you a lot of perspective. And that's a very short program. You think, God, I should know this. It's like 3 to 6 months. And again, CNAs, those are certified nursing aides, and they are just such an important piece of the nursing realm. I don't personally believe a lot of the time they get enough credit, but the good ones, just like anything, there can be good and not as caring and loving, right? Are just amazing. And I've seen some very beautiful things. But being a CNA, so at Mission College, in order to even apply to so we don't even offer just a straight RN program. So that's one thing to look at. Some schools, such as De Anza, they offer you can go straight into an RN program. I think Evergreen is the same thing. There are certain schools you can just go straight RN. And I'm not going to go into the bachelor's, master's. I'm going to stick straight to the associate's degrees, because then this would be like a 5-hour video. But Mission College specifically, and there are others that are the same. I want to say Gavilan, but I'm not 100% sure. So please don't quote me. They do, and actually Hartnell and Salinas as well. They do, just like our school. You must do CNA first, which it wasn't that way when I went there. CNA first, LVN, and then LVN to RN. Personally, I really like that. I know the end goal, and it takes a little bit longer and this and that. However, I really like the fact that it gives you that comfort, and we're all different, first of all. So some people, if it's, hey, I want to be an RN, I've been a medical assistant for 15 years, 5 years, what have you. Or, hey, I want to be an RN. I don't want to do all this other stuff. I'm comfortable touching people, all of it. So it's kind of like you have to know yourself. So for me specifically, although I'm a very loving, touchy-feely person, it would have, I didn't do CNA, but I was very lucky that my first rotation in my VN program, we did a lot of CNA work, such as giving our residents bed baths and changing briefs and just getting used to touching people and being comfortable with that, because it's not always comfortable and it really helped a lot. So if I could have it my way, I would almost, for any program that's done at a junior college, I would make it to where it's CNA, VN, and then VN to RN. However, it would be you're just in, rather than this reapplication, because then you may have to wait, and yes, there might be some downtime. However, and this is kind of wrapping up this topic, what I did and what I recommend most people doing is take that time with the LVN and try to get a job. So what I did, I had a choice. I could have either taken a job and made some money. I had a really good job at the time, actually. So instead I volunteered as, it wasn't really a vocational nurse, but it was in a medical setting. So I was still in a medical setting. So I was still feeling that I was getting that need met while I was waiting to get into the RN program. So it's all preference. And I mean, honestly, if you applied, this is my personal opinion, if you applied to a program that's a VM program and then you apply to one that's an RN program, and in the end you want to be an RN, I would go in the RN program. Unless you feel, and this is just, and I'm being, again, this is my personal experience in watching students potentially struggle or whatnot, unless you feel that perhaps you need a little bit more of, like me, I'm a step person. So I went from VN, got my bachelor's in counseling. I think I told you guys this already. Got my RN, then got my master's. Now I'm getting my NP in my master's, as well as getting my doctorate as a DMP to be able to prescribe. So I'm a very step person. I could have done this all in like probably like 6 years, but it's taking me like 8 years, but I don't care because I can work as I'm doing it. So that's one other thing that you would maybe want to take into consideration, is that you can work as an LVN and make money, especially, I mean, right now where we live and the economy and everything. And people still do hire LVNs. And right now, especially because they do pay them less. I would say the average is about anywhere from like, again, this totally depends where you work, 23 to like $35 an hour. RNs make anywhere usually from about 40 to, and I'm talking associate, to about like 70. I have a master's, and I'm not going to say exactly how much I make. I probably already have, but it's over $100 an hour. So it just depends. And if you specialize. So I hope that helped. Sorry, it's just so individualized. So please, the person that asked this question, if you want more information, or anybody else that just wants, because knowing your personal situation can be very, very helpful. Do you have kids? Do you have this? Do you have that? How much time do you have to dedicate? Sometimes you just need to get it done. And you got to make that decision. The reason that I did it the way I did it, I wanted to go to De Anza, but they just drew names out of a hat. And I'm like, okay, I have a 4.0. This is ridiculous. I heard about Mission. They were like, we take people by grades, got right in, did that. They accepted me right into the RN program. It was perfect. And it, and then I went to USF, got right into their master's program. And it was just a really, and just as an FYI, they're usually pretty easy to get in if you have a good GPA. So I hope that helped. It's such a cumbersome question, but such a great question. So it's really about you. And please, who asked that question or anyone else, again, contact me. I'm more than happy to talk to you on the phone about this. This is a huge passion of mine to mentor, because I wish I had someone to talk to about different choices. Okay, so let's move on to the second question. I'm not sure if you can give advice about this or have answers, since it can be different for everyone, but I am wondering if I have any input on how we can pinpoint if nursing is for us. I love this. And I'll tell you why. But I'll finish reading the question. Actually, I'm going to answer a little bit of that right now before I even continue. And that is because I always wanted to be a nurse practitioner. Well, originally I wanted to be a physician, but my heart is nursing, and we need everyone, right? But my heart I am a bleeding heart. Like if you knew me in person or were in one of my nursing classes, like, I mean, I was meant to be a nurse. I do truly believe it's a calling. But I will say this, I hate needles. I hate blood. I don't like giving injections. I don't like drawing blood. And people are like, how are you going to be a nurse? Right. I mean, either I would have got used to it, but somehow I just ended up falling in love with mental health nursing and teaching. So I ended up really, I can teach it, but I don't really have to do it. I don't know if that really makes sense. I don't do it in the RN program. But for the VNs, I teach them how to do injections, and I don't have a problem with that. But it's absolutely right. How do we know it's for us? So my first instinct of that is one reason too. I was like, maybe doing the LVN program first is good too, because maybe I'll get into it and be like, I cannot do this because of that. Because when you're an NP, not saying you're above anyone, but I mean, you're above in the way that you can write certain prescriptions and do things in a different scope of practice, but you're not the one drawing the blood and giving injections usually. So, but I had to go through all that other stuff to get where I am, right? Okay. So that is a really hard question to know. So I recommend, and now I want to read the rest and then I'll loop back around. So the rest of the question says, for me, I know I would be a great CNA, but I have a lot of doubts I won't do well as an LVN. Why? And then especially an RN. Do you have any advice for those who don't get into the LVN program? Do you suggest is immediately finding jobs at hospital first once we finish the program to receive our license? I'm not sure if I understand that last part. I apologize. Do you suggest is immediately finding jobs at hospitals first once we finish the program? Oh yeah, definitely. So this is a little bit of a complex question as well. So straight up, we don't know. We don't know. You can start the program and just you're like, this is not for me. There are going to be certain instructors that you just do not mesh with. These programs are rigorous. They are your life. They're not easy and they're not meant to be easy. And it takes a toll. It is your life. It is like, in my personal opinion, I've never been to medical school, but I will tell you this, my VN program was harder than my master's program to me. Now, could that be because I was at a different level in my education? I think it had to do with the fact that you kind of become a professional student after a while. I think that has something to do with it, but also you're just learning a ton of content all at once. So we don't really know if it's for us, especially if you don't have a specialty in mind. Like usually some of us will be like, oh, I really want to work in surgery, or I want to work it with babies, or, mental health, or this or that. So that can be helpful. And sometimes we just don't know. Now, this person mentioned that they would make a great CNA. Well, I'm going to tell you, in my personal opinion, if you think you'd make a great CNA, I don't see why you wouldn't be a great LVN, because if you're a great CNA, that means that you are usually caring, empathetic, really care and about what that patient's feeling and helping them. And you can, stopping at LVN is not like a failure. I feel almost like we have this like thing where it's like some people, and this is just what I hear. Where LVN, oh, if you stop at LVN, it's just like you didn't go far enough or whatnot. And if people want to be CNAs for the rest of their lives, that is one of, I don't want to become religious, but I'm just going to say, bless them. My God, it's a hard job. It's hard on the body. Nursing in general is hard on the body. So there's no perfect answer to this other than you just trying it out, because what you do is you go to clinicals. So you basically start, I would become a CNA, go do the CNA program, become a CNA, be in the hospital, be around it. I would start working as a CNA part-time or full-time until you get into a program, get into a vocational nursing program. That would be my advice for this particular scenario. And you start with skills. You would actually then you would be working with me because I teach in that program more than the RN, but I do go back and forth. And we would be working together. You would learn skills and do all that. And then you start clinical. And that's kind of where and I'm going to be very honest, and please, I hope who wrote this is listening. I even said because I'm going to be real honest with you guys, especially right now with COVID, we are so limited. We don't do medical surgical units like hospitals unless you're in the RN program right now. Your med surg is in skilled nursing. Personally, I love it. To me, it's almost like mental health and working with the geriatric population. But you get to do injections. You get to help with oxygen, read charts, learn a lot, care plans, all this stuff. So I would recommend starting out as a CNA, working as a CNA. You may hate that too, honestly, and that's just not for you too, or not too, but potentially. And then just going for it. Because if it's even on your mind, I would take the plunge. I personally. And if it doesn't work out, then it doesn't work out. I mean, there's many people in the world. I want to be a lawyer. I want to be this. I want to be that. And then you change your course, and that's okay. Again, if you have more questions and want me to be more specific, I'm happy to do that. Let me know. And I hope I answered your question fully. The next question is, do I need experience as a CNA to be accepted into the LVM program at Mission College? Not experience. You need to have the certificate. However, if you do have experience, you will get more points. So the LVM program versus the RN program. The RN program is more random. The VM program is more specific. So you get points. So if you work as a CNA, you're going to get more points on your application. So you're going to have a better chance to get in. But you do have to have your CNA certification, which means you could take it at another school, but you could take it at Mission College. From what I hear, it's pretty not too backed up. It's pretty easy to get into. And personally, from what I've heard, it's a really good program. And so yes, so you do need your CNA before you apply to the VM program. And but no, you do not have to work. It will benefit your application, especially if maybe your grades were a little bit low or your TEAS test or something like that. And then, is it better to go straight into the RN program? We talked a little bit more about that earlier, and it really, again, it just depends on the person. I'm really glad the way I did it. That's all I can say. I'm glad the way I did it. I'm glad I did LVN and then I did RN. But I could have done RN and then said, I'm glad I just did RN. So that's just from my personal experience. And you have to kind of, I think, know yourself. The main thing I think, and that I'm going to close with that kind of what's better doing LVN first or RN is number one, which one you get into. I would apply to multiple programs. So I applied, I think, to 3 different places. One was an LVN program and the other 2 are the RN. And the RNs were both lottery. No, one was a lottery, one was a wait list, and then Mission was by points. And I got into Mission. So I started Mission. Then I was actually contacted by the waitlist RN program. I don't even remember where it was. Oh my gosh. Maybe it was Evergreen. I can't even remember. And I actually turned it down. I was in my second semester, but my friend went because they got in somewhere. But I was like, I'm already invested. I've made like my family here. And I mean, my family, like of my cohort, and I'm halfway through this program. Like, I am going to finish it. Right. So, hopefully that helped. Okay. Mental health question. Okay, so what advice do you have for us who are interested in mental health nursing, whether it is CNA, LVN, or RN? A broad question. So I'll do my best to hopefully, and again, if I don't answer anything specific or something specific that you're curious about, text me, call me. I'm happy to talk to you. We'll make some time. Office hours, right? So my advice is this. I don't know if I mentioned this. I think I did. I had no idea when I started nursing that I wanted to do behavioral health, mental health. Honestly, I was like, no way. I come from, and we share certain things. My mother was extremely mentally ill. Both my parents were, before they passed away, addicts, and my dad did have 17 years clean. I always like to say that in his honor. And it was something that I was just like, I had to deal with this my whole childhood. I want nothing to do with it. It was like not even on my radar. I want to work with not babies necessarily, like pregnancy, but I wanted to work more like infectious disease and be an NP, like work with like maybe, women that come into a clinic, like the clinic situation that maybe have HIV, and be that person to give the news and that kind of thing. Like, I know that sounds so odd, but I just thought I would be a good person, which if now you link it together, what does that sound like? Kind of mental healthy, right? Interesting. So, and I was kind of interested in mommy baby when we did mommy baby. They don't do that right now because of COVID, but I really did love that. So my advice is this. So this is why they do. Wait, I just want to read your question. What is your advice if you're interested? Okay, so this is why they do clinical, because they take you to different places. So they take you, and that's one thing I really do love about our program is we take you to mental health. We take you to this. We take you to several different areas so that you can experience it. However, of course, a different experience. Like, for example, today I had clinical with my students at the VA, and it was the lockdown unit mental health. Yesterday for San Jose State, I taught at San Jose Behavioral Health, which is also a lockdown unit. They're very different. The students are different. It's just different. There's outpatient, there's all sorts of things. So for right now, I just want to make sure what advice, if you are interested in working in mental health, nursing, whether it's a CNA, LVN, RN. So my suggestion would be to look on Craigslist. It kind of depends where you are right now. So there are a lot of places that do mental health that you guys probably don't even potentially know about. I mean, my God, I could probably list off 15 right now. I mean, from Momentum, there's so many different kinds, and that's more crisis management. There's housing, there's the VA, so there's hospital-wise, there's houses that take in those with mental health disorders. There's emergency psych services in the emergency room. There's what I do, outpatient addiction, and I work with those who are suffering with addiction, and I do an assessment, and I run groups. I mean, there's so much to do. So my recommendation would be to start looking up different mental health facilities in this area or wherever you live, and start doing some research. Again, if you want more names or something like that, feel free to give me a text and I can help you with that. But there are a ton. I will tell you right now, El Camino pays very well for what's called a sitter. So I just want to introduce you to that term. And a sitter is basically somebody that it is very similar to a CNA, other than you're not really like you're not turning the patient and doing stuff like that. You're basically sitting to make sure that they're staying safe. But I will say, I think they pay like $35 an hour. I mean, that's pretty, this is a knock shift, so it's overnight, but still, my God, that's pretty darn good. And I will say this, and I'm not saying I'm recommending this facility, but San Jose Behavioral Health will hire you in a heartbeat, because they go through people like quite frequently. That's what I will say. And that's called a behavioral health technician. But if you're a CNA, I believe that qualifies. Hopefully that answered your question. If not, let me know. Okay. The next question, I think we have 3 more. I want to make sure I don't miss one there. Okay. And there's one other thing. There's methadone clinics. That's actually where I wanted to start, but they wouldn't hire me. At first I needed experience. So I actually started at a residential where those that are suffering with mental health and addiction would live, and I would give medications, and I learned how to therapeutically communicate. And you learn a lot of what you learn. Honestly, you need nursing school for your foundation, but you basically learn most of it on the job. But methadone clinics, I think, are great beginning places to work. And if you don't know what that is, please feel free to give me a text, and I can give you more information. But it's basically, I don't want to say it's easy, and that's why it's good, but it's both. It has its challenges, but it teaches you a lot. However, it's not like you're on the floor. You're basically passing methadone. You call someone's name, they come to the window, you verify them, and you give them medication. So, okay. The next question is, what characteristics and skills should nurses have, and how can we obtain or develop them along the way in the nursing journey? Oh, I love it. Oh, that's a very good question. So this really happens. That's so interesting that you asked that, because that is the question that I always ask my students on the last day of our clinical. So our clinicals, depending on what clinical we're in, and when I say clinical, that means we go to a site, like a hospital or somewhere, and then we're on the floor and we're you pick a patient, it's a whole thing. We have contracts with different facilities. And really for this one, this is very open-ended and broad, but characteristics and skills. So you get that in nursing school, number one. Some of us get some things much quicker than others. We all have our strengths. Me, gift of gab, that literally. And everyone said you're going to be a psych nurse. They were like, I'm like, you're tripping. No, I'm not. Because I love to talk to my patients. I was that one. Everyone was kind of like hesitant and whatnot. And of course, yeah, I'll push this med, whatever. But the IVs, that kind of stuff, it really never interested in me. I was more interested, who is the patient? What is their story? Like, so for me, the characteristics and skills, I mean, I would hope empathy, of course, and caring truly about the outcome of the patient. We teach you everything, which is great, right? Well, not everything, but most of what you need to know, right? Of course, you need to teach yourself some things. And then you develop your own kind of way. And I think that's what makes, I mean, any job, but nursing, of course, because that's what I'm in, very special, is that you get to develop your own kind of set of characteristics and skills of your equity and honesty and all of that. And I do think a lot of, like, for example, where it says characteristics, honesty. If you make a med error and you could potentially hurt a patient, you need to speak up, right? I mean, because you could give a medication, a blood pressure medication, and the blood pressure was already low and you didn't check it and you made a mistake, but you could save that patient because they would need fluids. But if you don't say anything because you're scared, which I of course can understand, the patient can die, right? So being honest and really paying attention and taking this very seriously, I think is something that is very, very important. And then the end of the question of how to obtain and develop them along the way in your nursing journey. This is honestly probably the simplest question part, which is you grow. You grow so much. And that's when I was coming to when I asked the question. So tomorrow is our last specific clinical day at this clinical rotation, but I asked the question today and I said, it's a mental health lockdown facility at the VA. And I asked each of the students, and these are LVNs already, and it's an RN program. So LVN to RN. And I asked them, I said, what about yourself have you learned by being here? Some of you have done psych before, because not all VM programs do mental health. What have you learned about yourself? What or what has opened your eyes, or what do you see that's different? And I mean, the answers, of course, I'm a sap. I tear up, and because it's such a beautiful thing. The journey in itself changes you. That is the answer. Like it's, and I think maybe also because I love what I do so much, hopefully you as well, and will find that place. And it's just, there's there are no words. That's all I can say. Okay, 2 more questions here. Thank you for bearing with me. I know I do not do brevity well, and I again wanted to do this straight from like my heart. So I only read like the first question and saw how many there were. Okay, so when nursing students should choose the specialty area, or the area of interest they want to work in, when? A lot of the time, I think I mentioned it a little bit earlier, but it has to do with, usually they go in thinking, and they could leave also wanting to still do that. Most people kind of have an idea, some don't, and that's totally fine. But because we expose you to so many different areas, it really helps develop like, oh, I'm really interested in like IVs and giving injections and medicine, or like passing medications, or whatever it may be, or working with pregnant women, or and that's the whole point of clinical too, is getting hands-on experience and helping you to see what your specialty, which specialty may pop out to you. So we help you along the way. And then the second part of that question is it easier to get into the RN program once I get the VN license? It depends. And the only, I don't have, I'm not a part of the process for the RN program intake. I do the VN one. But what I do know is that if you get good grades and you get, honestly, like your TEAS test, and if you don't know what that is, look it up. And I mean, basically the better that you do on all of those things, and keep your grades up. Take this seriously. Keep your grades up, because if you want to go from a VN to an RN and then maybe get your bachelor's, and by the way, you can skip completely over your bachelor's now. You don't even need it. You can go straight from an RN at Mission College and go straight to USF and get a master's. I didn't do that. I didn't know that you could at the time, but you can do that. And not that pay or money is the reason, hopefully, like, I mean, why? I mean, it's a perk. I mean, there's quite a big pay difference between the two, right? So I would have to just say that it definitely, I don't want to say it's easier, but just keep your grades up when you're in your VN program, get your license, pass. I don't know if passing on the first time counts. I don't think it does. I know it looks good for the school though. But it's basically, and I'm just going to be honest, we want you to pass the test. We want you to pass the board exam. So if they took you into the RN program, they basically, and it is random. It's totally different than the VM program. So that's kind of a hard question to answer. Sorry about that, but I hope I gave you some information. Okay, now the last question here. And again, if anybody has anything else that they want to ask, and it's, or more detail because it was specific to you, I'm always here and I'm happy to help you. Okay, so the last question is, what do you need to do in order to become a traveling nurse? Ooh, like what kind? Nope, this is perfect. Like what type of schooling path should we take? Same thing. You do the same exact thing. That's a great question. You literally take the same path as every other nurse, and then you apply for travel nursing. So instead of going and applying at El Camino Hospital or Good Sam or skilled nursing or whatever it may be, you look up travel nursing and you apply for that job. So it's literally, you are the same type of nurse. It's not a special like travel nurse behind, like special letters or anything like that you need. You go the same path, and you can choose that as your, I guess it would be your specialty, if you will. So nice. That was a very different question. I like that. That was a very easy to answer. So that was nice. It was the last one, because I'm sure I am boring you guys. I'm so sorry. It's hard to answer these questions because I want to be as detailed as possible. So I'm going to go ahead and upload this. I'm going to say it one more time, probably the 8th time. Let me know if you have any more questions. I'm going to post this, and I'm going to get to work on the diabetes, that thing, the video. All right. Thank you so much for posting your questions. I greatly appreciate it. It just shows how serious, and again, not everybody needs to do it. And hopefully, if you're interested in the medical field, even if you didn't post a question, maybe one of these will be helpful for you. So I hope you guys are doing very well, and I miss you. I'll see you guys on Tuesday. Thank you so very much.